On August 31, Health Minister Dr. Frank Anthony announced that as a means of reducing an enormous backlog of COVID-19 samples to be tested, 500 samples were sent to the Caribbean Public Health Agency. He noted that the results were expected to be returned by Friday last. Deputy Chief Medical Officer Dr. Karen Gordon-Boyle on Monday confirmed to this newscast that 300 of the tests that were sent have returned. The others are expected later this week. Last week, Dr. Anthony had revealed that the public health system had been burdened with a backlog of 1,900 COVID-19 test samples. That figure has been reduced to below 1,000. At the weekend, a total of 52 new cases of COVID-19 were recorded, which brought the total to 1,468 as at September 6. Owing to the fact that persons seeking to be tested are at different levels of the disease, Dr. Anthony divulged that the ministry has prioritized the way testing is conducted.
So a person who has been in hospital and they're critically ill would get first priority. Health workers who have been exposed get first priority. So we have categorized the way that we are processing samples, and I want the public to understand that as well. So an asymptomatic person who thought they might have been exposed show up, got a sample done or got a swab done, and that sample is sent for processing. It is not the same as somebody who is critically ill and in the hospital, and we really need to know whether that person is positive or not.
He outlined that samples of hospitalized patients are expedited for testing.
And that is what has been happening so far. So I'm really sorry for the delay for some persons not getting their results in time. But this is what we've been doing, and I think when you have this type of scarcity, we have to prioritize.
With the lone testing machine currently at the National Reference Laboratory, processing of samples collected takes approximately 9 hours. The ministry has since amped up its human resource capacity and implemented a 24-hour shift to ensure an increased amount of samples can be processed daily. An automated machine is also being procured.
We have since ordered one such automated machine, and we believe that it's going to cut the processing time from 9 hours to about 2 hours max. And we'll have the capacity of doing 96 tests within 2 hours. And if we run that several shifts, then we can actually do maybe about 500 to 800 tests in a day.
Temika Rodney reporting for the HGP Nightly News.